generally autism regression is mostly it's a social communication regression. So either children will lose some social skills or speech skills, or it is both. So 19 to 21 months is the time when the mostly regression happens in children with autism. A child who was making eye contact, a child who was responding to name call, suddenly stops. Now 40 to 50% of cases, parents report some kind of precipitating event before the regression. Parents coming at the age of just around 2 years, when they started noticing that there is since last 2 to 3 months there is a change. My child who was very active, who was responding, now suddenly he is remaining silent.
Hello everyone. Welcome to India Autism Center podcast, your trusted platform for meaningful insights, practical guidance, and real support about autism, neurodevelopmental disorders, and primarily parental support and care. I'm your host for this session, Pooja Datta, and today we will be delving into a very crucial, a very important topic that many parents, they find confusing and deeply concerning. Yes, we will be speaking about regression in autism. And to explore this discussion further, we have with us our esteemed guest, Dr. Praveen Kumar. Dr. Praveen Kumar is a neuropsychiatrist and a child and adolescent psychiatrist. So welcome, sir, on the show. How are you?
I'm fine. Thank you.
Sir, it's a privilege to have you here in the show. And sir, can you please share with us a brief journey of your profession and how did it align with autism?
Yeah, okay. First of all, thank you for inviting me to this program. Actually, my professional journey started with once I completed my MD training, then I opted for, because I had interest to work with children. So especially developmental and emotional problems in children. So then I started doing fellowship at Christian Medical College, Vellore. And it's an institute where there are two important divisions. One is developmental unit and an emotional disorder unit. And there were some almost on 25-30 beds for developmental disorder unit. So where children with different developmental disorders like autism, ID, so these children are admitted for a period of 3 months. And they undergo training, intensive training. So, and this training is done by different therapists, OT, speech, and all. So, and that is supervised by child psychiatrist. So, we as a child psychiatrist go every week to each parent, each family, and we talk to them and what was the progress done in last 1 week. And what are the challenging behaviors children are facing, and how we can help those challenging behaviors, both non-pharmacologically and pharmacologically. So and we used to discuss what's the progress happening after the end of 3 months. So what was the baseline and what is the 3 months? So that somehow it started interest in me, and a lot of children started improving with respect to that intensive structured training program. So that's how then, so I finished my fellowship in child psychiatry at CMC. Then I joined Institute of Neurosciences, Kolkata. And then I started my work with respect to especially planning a lot of some academic programs in autism, doing CMEs on autism. And so we started our own unit of early intervention at INK. So from the very beginning, the management at INK was very supportive with this plan. Yes, we need to have a specific one psychologist dedicated to this intervention program. And so we had a one dedicated psychologist for assessment, and we had one play therapist. She will do with, I was very clear that we need these children get diagnosis, that's very important, but what after diagnosis matters very important. So I was very clear from the beginning that these children need a good interventional therapist. It's not just about diagnosing autism, how to help after the diagnosis, how you can focus on improving individual symptom of the autism. So, and a lot of parents sometimes when they get diagnosis at age of 2 years and all, so they are in shock, sometimes dilemma whether it's actually autism or not. So with the amount of information available on the Google. So sometimes parents get very shocked, and the so we feel that like autism diagnosis means there is a poor prognosis, and so giving them the proper education and giving them the hope is very very important, like saying that not all children with autism are same, it's a spectrum disorder where there is a severity ranges from very severe to very mild, and children do get better when there are mild autism if you start very early interventions and all. And seeing children getting better it itself motivates me, and when a psychologist says like we have done a reassessment after 1 year and child has come out of the autism, that although it happens in very few cases, but that itself will give you a motivation that yes, this is not just something. Autism means not always carries a poor prognosis. No, we can work with some children if you do proper early intervention and proper guidance. A lot of children do make meaningful recovery, and supporting them through childhood, supporting them through like what type of schools, how to navigate some behavior issues. When these children enter into the school, there will be some minor behavior issues, attention issues, managing them and helping them to go through the school. And when they reach adolescence, some of the behavior issues, and so the adolescence related issues, supporting the parents that yes, this is common, how we can manage these issues. So I think so this all motivates me and helps me learn more, so more what are the new advances coming up in this field, how we can help children and adolescents with autism in a better way.
It's a very enriching journey indeed. So, to start with, for many parents who are watching there, and maybe they are not even aware of what is it, what is autistic regression and how does it look like?
Yeah, so regression in autism is a one interesting and puzzling phenomena, and so if you see technically, regression means it's loss of acquired skills. That's by definition. So a lot of parents do come and report, my child was doing well, and say up to 1.5 and 2 year. Around 2 year, he started. He stopped speaking. Some parents report he stopped speaking. Some parents report somehow there was decline in his words. He did not develop the speech after that. He was speaking some words and then he stopped speaking. Some parents report that he was almost like he has learned the words, he was telling the rhymes, he was going to school, then he lost the words. So like regression is basically loss of acquired skills. That means so children do develop speech and then they stop speaking, so and a child who was making eye contact, a child who was imitating, a child who was responding to name call suddenly stops responding to name call, stops making eye contact, imitation goes down. So generally this phenomena happens around say 1.5 to 2 years. So what we typically say, if you see the research, so 19 to 21 months is the time when the mostly regression happens in children with autism. And this regression is unlike neurological regression, there is only regression in speech and social domain. Sometimes it is both speech and social domain. So and generally if you see roughly 1/3 of children with autism, they develop this regression. Not all children, but so prevalence varies, prevalence varies means although there are studies saying that like maybe 30 to 40% of children with autism report some amount of regression, so basically now what happens is that regression can be sometimes very sudden. Sometimes it happens gradually over a few months, like maybe 2 to 3 months. Now parent starts noticing that he was doing well, he was making some words, he was responding and all. Then we are seeing that since last 2 to 3 months he's just started remaining in his own world. He's not using more words. and he's not making eye contact, he's not imitating. So this is the clearly parents report. Sometimes even parents come at very early age also, not like sometimes parents come at the after the diagnosis of autism. When you retrospectively ask, yes, my child was, he was doing very well, then suddenly there was a regression. But some parents do come at the age of, I have seen parents coming at the age of just around 2 year, when they started noticing that there is a, since last 2 to 3 months there is a change. My child who was very active, who was responding, now suddenly he is remaining silent, he has lost those words. So this phenomena, what we say, called regression.
So, sir, before the regression happens, for some children, they're absolutely fine. Absolutely, they have normal developmental parameters.
Yes. So, this is what actually researchers looked into, whether these children who are losing these words, whether these children were completely fine before. So, then Ojanov is one person who has done a lot of research in this area, and we also did our own like we did our own research on parental reports on developmental regression in children with autism. And what's being found is 50% of these children, they are already having some delay, maybe some social delay, some it's not like completely age appropriate socialization. If you ask them very clearly, was he speaking completely, was he using completely words, or was he making completely eye contact was as perfect as your another child, then they will say, no, his eye contact was not as good as my another child. So out of this regression, some already another 50% of these kids, those who report regression, they are already having some delay in the form of social development or communication. Even though they have developed speech, you can, parents sometimes report that it was not like a very clear speech. He was developing, he was making some words, then he lost. So he was a bit socially shy. They will report like this. He was bit socially, bit not that active. So sometimes parent report even before, if you specifically ask, was he completely mixing with other kids and all? No, he was bit socially shy. He was not that mixing. He was not that making eye contact. What we this one. So 50%. But so as I said, prevalence is around 30 to 40%. But 20% of children will have absolute average development like typical children, then they lose the skill. This is also, we have found, and research has also found that, like Ojanov and all, most of the research on development, they have found that there are 15 to 20% of kids who developed absolutely fine. So I have myself seen children, they were completely fine. That means even they were speaking words, they were speaking in sentences, and they were speaking the rhyme meaningfully, making eye contact, responding to name, imitating. Then they lost the skill. So this is also there, like 15 to 20% of children will have. So that's why if you see the onset pattern, now some children with autism will have symptoms from very beginning. There is a speech delay, social developmental delay from very beginning. Some children having some mild delay in the symptom, then they regress around the age of say 2 years. And another subset children, they have completely typical development and then they regress. So this is the 3 different pattern we see. Another pattern parents report is a child was doing well, he was speaking, but his speech did not grow further, what we say as plateauing, developmental plateauing. So these are the different onset pattern of autism we see. So as I said, generally most of the children will have symptoms from very beginning. 30 to 40% children will have this phenomena called regression, and out of them 20% children will have completely typical development, 15 to 20%, then they regress.
Okay. So, sir, does it happen abruptly, all of a sudden, or is it gradual?
So, it can be sudden or it can be gradual, but most of the children, what parents report is it's gradual. So, it gradual means over a period of say 1, 2 to 3 months, they have noticed that previously the child who was speaking well, who was using words, now he's not responding. That's how they will come with he's bit like he's not that active, he's not imitating, he's not making eye contact, so he's not responding and he has lost the words. So it's generally in most of the parents they report it's a gradual phenomena over a period of 2 months, but few parents sometimes report sudden, no, he was completely better, but generally it won't happen so sudden like this one. So mostly it's a gradual phenomena. So over a period of say 2 to 3 months, parents start noticing that.
So is it like there are common, conceptions that there is a viral fever or there is some kind of, measles or pox or anything, and after that the child starts regressing and shows autistic features?
So we also looked into like sometimes in say 100 children regress. So now 40 to 50% of cases parents report some kind of precipitating event before the regression, or what we say preceding event before the regression. Now this preceding event can be medical, preceding event can be psychosocial also. And what we have found is some parents reported that there was like a GI, he had a diarrhea, after that we found that he regressed. Some parents reported that he had a viral fever, after that he has regressed. Some parents reported that he had a febrile seizure, after that he regressed. Some parents reported that he had some fall, head injury, then he regressed. These are the medical causes. And sometimes even psychosocial causes also parents have reported. Like what they have said is, we were in a different country, we moved from that country to here, or we have moved from one country to another, then we noticed there was a regression. We moved from one place to another, we were in a very big family setup and we moved to where there was not much of children or social mixing and all, so we noticed there was a regression. Some parents have reported he used to have one very good maid servant who was very interacting, and that maid servant left. After that, they started seeing. Even some parents have reported like there was one elder sibling was there, he was playing and all, he left for some other studies and all, we started noticing. So these are all precipitating or preceding events parents have reported before the onset of regression. Now, whether these events are causing regression or contributing the regression, that is what we need to find. So mostly it's a parental reports. So but that doesn't mean that those events are causing the autism. Maybe it's like as you said, autism is not like a single one cause is there. So there are a lot of genetic factors involved and also environmental factors, because the etiology of autism is still evolving. We do not exactly know what exactly causes the autism. Yes, but there is a lot of research evidence backing up that yes, there is a maybe 60 to 70% there is a genetic causes for autism, and another maybe 30 to 40% environmental causes. Now, among environmental causes, what are the environmental causes? Those things there is a lot of research. Is it some environmental cause, maybe some kind of pregnancy complications? So people have found association with exposure to certain drugs during pregnancy, like valproate, and certain drugs they have found a link with autism. And some people have found severe pregnancy complications with very low birth weight, and also they have found some association. Now, and there are also some other environmental factors people are looking into. These studies are going on whether kind of any pollutants or air pollutants are somewhere linked to autism. So this is a research going on, and nowadays one major issue which has come up is excessive screen time. Is it somewhere contributing or causing anything? So these are all the things. So what happens is now generally parents will attribute the cause as per the available information or in the environment where they stay. So they attribute the thing. Now, but lately we are seeing a lot of parents do report that he was doing very well, but there was excessive exposure to screen around the age of 8 months, 1 year and all. After that we started noticing there was a regression. So this is a new thing. So maybe parents recently, so maybe 10 years back, 15 years back, these parents were not reporting, but maybe now, especially after the COVID time, during the COVID time, lot of parents do report that so he was speaking well, he was initially making eye contact, then there was somehow excessive exposure. After that, my child started declining, not making eye contact, he has lost words. Now, whether this causes autism, this is we need to do a lot of research, or is it causing autism-like symptom? That is what we there is a lot of words regarding like autism-like symptom, techno autism, virtual autism, what we have seen. Definitely what we see is there is a, definitely it is causing some kind of language delay in children with autism. So because first 2 to 3 years is a very important critical period of the brain development, and this time children need lot of language stimulation. So when that language stimulation is displaced by devices, so that language stimulation is not happening. So whether that is contributing to children the language delay, and they are not getting adequate exposure both from speech point of view and social point of view. So whether that is contributing to these things, I think maybe the research is looking into these things. So we'll be coming up with answers regarding that.
Sir, so there is nothing like conclusive, like you said.
Yes.
It's all now researches are happening.
Yes.
Sir, apart from the social problems and the speech, are there any motor regression, motor delays as well?
Yeah. So generally in autism regression, what we describe it as, it is called socio-communication regression. That means regression is happening mostly in social and communication domain. Motor regression very rarely we see. And if there is a motor regression, we suspect there might be another medical cause for the regression. Another medical cause means, is there any neurological cause for the regression? We have to be careful. So because there are some lot of genetic syndromes, neurometabolic disorders. So these disorders can also present with regression, but generally these disorders will have motor regression. So whenever generally, so in autism regression, if somebody says that my child was walking and he stopped walking, that means it's not might be related to autism. There should be something we have to look for. It might not be just related to autism. We have to screen for other pediatric neurological causes like neurometabolic, genetic or degenerative. So generally autism regression it's a social communication regression. So either children will lose some social skills or speech skills, or it is both.
And so that will have an impact on the cognitive skills as well?
Yes. So now people have looked into whether those children with autism with regression and children without regression, whether cognitively they are different. That means whether regressive children will have more cognitive impairment, more severe cognitive impairment compared to non-regressive children. Research has looked into that, but there are mixed findings. That means most of the research says there are no significant difference between these two groups with respect to cognitive ability. That means regressive and non-regressive autism, although regression is happening in these children, but cognitively there is not much difference. Most of the studies have found. But some studies have found that those with regressed children are more socially impaired compared to non-regression. But in our study, we also did not find not much difference. We also looked into the developmental quotient between these two groups and autism severity also between these two groups. We did not find any difference between these two groups, regressed and non-regressed. So but literature is mixed regarding that. So maybe some people, some research have also looked into more severe the regression, more they are impaired. Okay. More severe the regression, more they are impaired with respect to cognition. And
sir, you just now spoke about autism-like features, which is due to screen time. Can this autism-like features be reversed?
Yeah, so this is what we will be looking into. We are planning one study on uh, children with screen use, whether a strict screen product reduction protocol would help these children to regain their typical development. That is what will be looking into. But what our clinical experience says is a lot of parents do report that once they stop the screen use, a child who was not making the speech, who was not making eye contact, who was not responding, they have started responding. Okay, now this magnitude of improvement is variable. Some children almost they get back, that means they get back to almost typical development trajectory. Some children moderately get back their skills, and some children do not get back. So that means stopping the mobile is going to help completely. Yes, definitely it will help, but majority of children it helps. Some children maybe I think they need a other interventions also. So what we have found is yes, it definitely helps some children. Maybe those who are having I think mild symptoms, mild regression, and so if they stop the screen use and all, so some children are getting better. So some children parents have noticed that their communication has improved, their eye contact has improved, their response to name call has improved. So in interventions, we always tell parents to reduce the screen time, especially during this critical period of brain development. So if you see, that's why all the guidelines, American Academy of Child and Adolescent Psychiatry, pediatric guidelines recommend that zero screen time for less than 18 months of the children. That means it's a zero screen time except video chatting. If your parent is outside or somewhere in other country, you can do the video chatting, that too with the parental supervision. That means less than 18 months there should be supervision of the parents, even if they are watching, what we say co-viewing. Even if they're watching, you explain the content what they are watching. If they are just watching by themselves without any supervision, without any explanation, that is not going to help them. In fact, it affects their language development. Ideally, as per recommendation, zero screen time should be followed for less than 18 months. Even if it is not happening, so a lot of parents do say that because my child doesn't eat, so because of that I have to give the screen time. Okay, fine. So even if you're giving for a brief period of time, so try to explain the content to the child and try to be with the child while they are watching. So that is important, and limit as much as possible. If it's not possible practically to the zero, because we find that it's not just about autism, all children now screen time is the biggest challenge for the parents. It's challenge for all parents, because whatever we say, it somehow it becomes difficult to implement practically these things. So when what practically we can do is that's why I tell the parents as minimal as possible. So if you think that during eating time you feel that, but make sure that you do not allow them to watch alone. Supervised watching, very important. And for very young children, you explain the content, so that especially what they are watching, you can talk to them. And so this looking at the screen, looking at you, that will stimulate their interaction. But if they are just looking at the screen, that will not improve the language development. So that's why, so what I mean to say is definitely yes, screen reduction improves the development. So that's why we need to reduce the screen, because maybe whether it is causing autism or not, more than that, it generally improves the language of all children when they reduce their screen time. See, because moment you are reducing the screen time, basically children are getting human to human talk. That means we need like a what is that called, this talking with a human is very important. Children need this thing for their language stimulus. So that's why what we say, you ask them to join to the play school. Why? Because once they go into play school, they start mixing with other kids. That stimulates their language. So these are all the factors are there. So yeah.
So this is very, very insightful. I am very sure the parents watching out there, even they will, gain a lot from this conversation. So to the parents watching there, if you feel this discussion is really helpful, please do not forget to hit the like button. Sir, coming back to the podcast.
Yeah.
So you were talking about regression that happens due to neurological factors as well. So how does it clinically look? Behaviorally, the regression looks in children who are having autistic regression and the children whose regression is due to some other neurological factors like encephalitis or seizures.
So basically, like children with autism regression, they, as I said, like it is mostly social communication. That means even if they lose certain skills, it's mostly in the social and communication domain. But whereas when we have to be careful, that means we need to be, see, in general, all cases of regression we should be careful, because even there are now studies looking into, especially first thing is when there is a early onset or late onset. That means a child who was very well up to age of 3 years, say he was speaking, he was going to play school, he was using words meaningfully, mixing with other kids, then he stopped speaking. That is bit atypical, what we say atypical autism. Or when child starts showing regression, say beyond 3 years, that is the time we need to think it might not be just related to autism. I have seen a child of around 4 years regressing after the birth of a second child. So the child was speaking and all, then he stopped speaking. So when there is a regression beyond, like when it is occurring, say what we say late onset beyond the developmental age, so that time we should be careful. There might be either medical or psychosocial cause which is happening. Now when children have motor regression, as I said, a child was walking, child was running, and there is you see that child motor regression is happening. Now child is not able to walk, or like child has developed the toileting skills. Now he was going to the toilet, he was indicating and all, now he stops. So generally, which won't happen in the we won't see much of these regression. So regression in motor domain, regression in the toileting skills, and also if then child is having seizure. So child, you see that around the same time, you are noticing any convulsions or this one, that means it might not be just autism related regression. We need to think about the medical cause. And if regression is very severe, in a sense, like now child, as I said, who was walking, who was using the toilet, now completely he's not able to speak, he has lost his motor skills, he has lost his toileting skills. That means he's not able to communicate and all. So that is happening in a very short span, acutely it is happening. Then we need to look for a other medical cause. Okay, so so like seizures is one important, and sometimes very rarely we see some cases with autoimmune causes. Autoimmune, this is a neurological disorder. It can present with regression in children with children. So generally they will have other symptoms like regression, they will have seizures, they will have acute behavioral worsening, sudden acute fear happening in children, which cannot be explained. So these are all like a constellation of symptoms. Not one symptom is not an indication of anything. That means child is developing just acute fear. That is not. I'm saying like regression, seizure, acute fear. Child is acute fear is happening. So and suddenly you have seen there is a rapid decline in the child. Like child has become very irritable, very cranky, irritable, not sleeping. So these are all the, sometimes we have to rarely autoimmune can also cause regression. Pediatric autoimmune conditions can cause sometimes regression. So and sometimes very rarely we see one regression called Landau-Kleffner syndrome, where child will have some easy abnormality, like then child stops just speaking. So that's why in any case of regression, so we should have one medical evaluation. Okay, so we do especially when it is bit later, definitely they need medical evaluation. Medical evaluation means So a pediatric one, maybe neurological evaluation would be definitely warranted in case of regression. Are we missing anything easy changes that is contributing to regression, or as I said, neurometabolic disorder? So these things and all, one proper evaluation by a pediatric neurology would help, especially when there is a regression in a, say, around 3-4 years and all. So we should be careful. And when regression is associated with motor regression, that means walking, tolerating skills and all, so we need to be have a proper evaluation.
So, for viewers out watching there, please have a look at who we are before we move into the next question.
Imagine a space designed not just to care for individuals with autism, but to empower them. A place where knowledge grows, support flourishes, and possibilities expand. This is India Autism Center. It is built to redefine how we approach autism. Through education, research, and community-driven initiatives, we create an environment where individuals with autism can thrive. Samavesh, our residential campus, is designed for individuals with autism to live, learn, and grow with dignity and independence. It is more than just a place to stay. It is a space to belong. Manan, our training academy, prepares professionals to provide specialized care. Through structured programs, we equip individuals with the skills to support neurodivergent communities with confidence and compassion. Khoj, our research division, is dedicated to advancing our understanding of autism. Through data-driven studies and collaborative research, we work towards shaping the future of neurodiversity.
Coming back to the podcast, sir, you mentioned that early intervention or therapy, it really improves this regressive tendencies in children or behaviors. Sir, can you please come around certain real life cases where you have seen that the child has regressed?
Yeah.
Early intervention has really helped.
So I think one I will report about 1 or 2 cases and then what general research says. So we had, say, some around 2 or 3 months back, only one child, around 17-18 months child, they came with a from a district, and they said since last 2 or 3, this child, they showed the videos to me. He was making eye contact, he was imitating, he was speaking words and all. Since last 2 months, there is a now they have noticed that this child is not speaking. There is and he's not making eye contact, he's not responding to the name call and all. So so this was the 2 to 3 months history. Now, when parents report this type of phenomena around 19 months, 20 months, around the 2 year, so first thing is like we take a detailed history. Sometimes there might be some psychosocial causes, as I said, parents report preceding the event. So maybe he was in a place where there was lot of stimulation, lot of people were there in the home. They have moved to a city or district place where they found that there was not much of stimulation, and at the same time child was also exposed to more screen use. Child was watching more mobile because there were not much of kids to talk, or not much of social environment was there to stimulate. Now child was also, we were busy with some things and all. So child, there was a increased exposure to screen, and we have noticed since last 2 to 3 months there is a decline. Now, so as a so we evaluated that child with doing one EEG just to exclude any medical cause, and just routine all investigations sometimes we do. With also we took help of one pediatric neurologist just to see anything else medical. So all investigations came normal, and we just started with him a protocol that yes, he's better now, his investigations are fine. So that means let's start the intervention. What basic intervention we all psychoeducate all parents, especially around the 2 years, is first I'll tell them to important is now they need language stimulation, language rich environment. Language rich environment means like there will be someone, we should, it's like whether they are responding or not responding, you keep on talking to them. Okay, so what they are doing, you keep talking. So one of the very important thing is, now I tell parents, so see, when they are developing some symptoms of autism, they are going into their own world. Now you have to go into their own world and repeat what they are doing. This is called joining in. Joining in means you just go into their world and keep repeating what they are doing, keep imitating what they are saying. So these basic strategies were explained to them, and asked to reduce the screen time. So engage with engage with children, play group and all. So and in a next follow up itself, the child started showing better. That means he was again making eye contact, again responding to name call, again started speaking few words, and they started also the therapy interventions, like a speech and all. So this might be some mild case. Okay, so as I said, like children now, there was one study which said that what we are seeing in a significant rise in autism cases, maybe the severe cases prevalence has remained same. The prevalence of mild cases has gone up. So people have looked into this type of research, and so we also feel that there is a significant increase in mild cases of autism. And mild cases of autism, they do get better if you do proper early intervention. So so the same thing applies to the regression aspect, as I said. So those with some psychosocial precipitant with the mild regression and all, they do get better if you start early intervention. So in fact, all children with autism, they get better if you start early intervention. What is early intervention? See, early intervention is, what is the gold standard treatment for autism is early intensive behavioral therapy. That means as early as possible, even if you suspect autism, you need not wait for autism diagnosis. The major problem with in autism is, see, children are, despite so much of awareness, now children are getting symptoms of autism at the age of 18 months, but they are getting mostly a formal diagnosis of autism at the age of 4 years, 3 years. So there is a large gap between the onset of symptoms and the diagnosis of autism. So this is concerning, because when we talk about early intervention is, you start as early as possible. Even if you suspect autism, basic interventions have to be started early intervention, because the research says that if you start early intervention before, say, 3.5 years, there is a maximum chance that these children get better, because the first 2 to 3 years the brain is very plasticity of the brain, so it has capacity to come out of any significant problem. So that's why so there is a need to start early intervention. And if you start an early intervention, say you have a child, there are autism symptoms, you start early intervention by 2 years, okay, the chances of this child having comorbid intellectual disability is 8%. Okay. But the same child, if you start early intervention by 3 years, chances of comorbid intellectual disability goes up to 27%. So that means there is a definite need that if we are delaying the early intervention, there is also, this child is also going to have intellectual disability percentage. So that's why there is a need to start early intervention. Even they need not wait for autism final diagnosis, but basic intervention can be started. So that's why there is a lot of focus on, and early intervention has given a lot of best results for children with autism. So as early as possible, that's why I tell the parents, let's see, because, and also even if you're having a doubt, even child, there is a confusion about autism diagnosis, but basic intervention can be started. And sometimes the stability of autism diagnosis, say around 2 years, is variable, That's why I tell the parents, whether he will also meet for criteria for autism at 3 years, we don't know. At this point of time, he is showing some features of autism. Whether he will continue to show autism symptoms at 3 years, we don't know. Some children might get back into typical development also. So at 2 years, somebody is showing autism symptoms, that doesn't mean that they will continue to show symptoms. People have looked into, some children are getting back to typical trajectory. So that's why, rather than so this is the education is very important, because once they have autism symptom means no, he is going to have this kind of no. So because at the age of 2 year and all, diagnostic, the stability of these symptoms is still not there. So that's why some children, they do get better and may get back to typical trajectory also. So that's why, even if you have a doubt of autism symptoms, at least start intervention. Early intervention can be started. Early intervention, like that's a separate chapter, but at least basic education to the parents regarding what I tell to the most parents is to imitate their words, making eye contact, how to respond to name call. So these basic things we need to work on, and the speech therapy and OT, so that can be started.
Sir, to the parents,
Yeah.
I think this will be very relevant. Without getting panicky,
Yeah,
what is the age?
yeah,
The parents, they should be alert.
yeah,
Because at times, parents and grandparents and relatives, they say,
yeah.
now there is time, he will again regain, and that leads to delay or denial. I can understand. But what would you suggest to the parents when they should really come to a professional? At which age, when they are seeing that the child is facing some concerns?
Right. So that's a very important question from parent point of view. See, a lot of there is a concern in the family, grandparents especially. Whenever there is a child with language delay, speech delay is there, they will tell that with age this person will grow up. His language will come back. Okay, we have seen. Are they saying wrong? Sometimes we think, to some extent they are true. To some extent they are wrong. How they are true is, see, all language delays are not autism. Any child who is having speech delay is not autism. So a child who is having speech delay, but his non-verbal communication is absolutely fine, that means he's just having expressive speech delay, or what we say late talkers, he is going to speak. So this is important to differentiate what is expressive language delay from the autism. Because these children with expressive language delay, or typical what grandparents say, my child will, he spoke at age of 3 or 4 years, these are all called expressive language. These children, they are making all the non-verbal gesture. That means they want something, they will tell. That means with non-verbally they can communicate. Their gestures, there is no problem, and they follow all instructions. Very important. You ask them to look up the sky, they will tell if the aeroplane is going, there is an aeroplane going. Okay. So, but he is not able to say, except that the child is absolutely fine. He is following commands, and these children definitely with time they will speak, because they need bit of just language stimulation they need. But whereas in autism, in addition to speech delay, expressive speech delay, they have a reception also. There is a difficulty. That means these children are not understanding the instruction. They are not following the gaze. Non-verbal communication is not there. Say, for example, child wants something. Now, this child, he is not able to say and also not able to gesture. So, whereas the children with only expressive speech delay, they are not able to say, but they can gesture. I want this water. That's it. There is a clear gestural indication. That means when child is, that's what we educate parents, that we see that first thing we see in a child with a language delay, how is the non-verbal communication? Is he making tata bye bye? Is he imitating you? Although child is not able to say, but if you ask him to imitate certain things, he is imitating. So that means, so this child is having just expressive speech delay, he is going to get better. But so that's why important is not all language delays are autism. At the same time, we should not neglect all language delays, as with time they will develop. So that is why, so when child is having speech delay, along with that instruction also child is not following. Child is also not showing any indications. Non-verbal also he is not communicating. That means do not wait for the time. You need to consult immediately. So that is very important.
And it can be, sir, as early as 16 months,
Yes,
18 months.
how fast you need to communicate, as fast as possible. That means there is no time that yes, we need to wait until this time. Sometimes there is a thing that with age he will develop. See, but what are the symptoms which are called red flags? If these symptoms are there, you need to consult irrespective of the age. Even see, we get children at the pediatrician, sometimes they refer children at the age of 14 months, 13 months, 14 months, because now there is a lot of research is ongoing on what are the earliest signs of autism, how early we can diagnose autism. There is a lot of research going on now. So as per the research, the child who is not making eye contact, so sometimes children as early as even 1 year, so most of the time by 6 months most of the children are fine, and the research has shown that even after 6-9 months child starts showing declining trajectory. So sometimes children at age of even 12 months, 13 months and all is not making eye contact, not responding to name call. Earliest symptom parents notice is, I feel my child is not responding. When I call him, he doesn't respond. Is he deaf? Sometimes they will wonder. But interestingly, there is a mobile, people say like whenever I call him, he doesn't respond. But when I start Cocomelon, he will respond. How come this is possible? So this is what we see in autism. So they do respond to their favorite sounds. They are not responding to name call, but because in autism, hearing is normal. If you do the Bera test, hearing comes normal. So a child who is not responding to name call despite normal hearing is a sign we need to red flag sign. A child not making eye contact, child doesn't look at the eyes, not making eye contact, and child like is not pointing. So, or we say like simple, I ask how you can test. A simple test you can do is you just ask the child to look at the light. So what child, generally a child will look at the light, whereas children with autism, they do not look at, because this is what we say joint attention. So both of us, let's look at the moon. So you direct, but he's not looking at the moon, or he's not looking at the airplane. That means that joint attention is not coming up. So these are all earliest signs. So that means we need to think it's a red flag sign. So there is no age that yes, at this age we have to, up to this age we need to wait. If there are strong signs, that means child not making eye contact, not responding to name call, remaining in his own world, not mixing with other kids, not imitating, not saying tata bye bye, not saying social, not using gestures. Even if it is earliest age, you need to take a help, because the earlier intervention is the main treatment.
And sir, finally, parents who are suspecting that their child is regressing and who are really concerned, what would you strongly recommend them that they should do, both emotionally and practically?
Yeah. So as I said, first important is to be aware that yes, so that is why it is important, especially around as I said, like regression mostly is happening around the age of 19 to 21 months. So like very important is to monitor the child, especially around this age group, to see that whether any skill loss is happening. So skill loss means whether my child, the words, is he gaining more words or is he losing the words? If at all child is losing the words, if at all social regression, that means child was making eye contact, responding, imitating, now he is not remaining in his own world. So whenever there are these early signs, we need to rather than thinking that like no, he might get better to take a consultation, especially when there is a speech and social regression or any regression happening. So that is first important, take a proper evaluation, because as I said, some causes are very reversible causes. We have to also exclude that everything. Sometimes it is better to have a medical evaluation, because as I said, some regressions are related to neurological cause, and if you just find the cause, treat the cause, sometimes that language improves. We had a child when I was in CMC, like this child had a regression, and there was clear easy changes suggestive of autoimmune, and the child was put on proper medications, like this one has his language got better. So we need to be aware, although there are 10% of such cases which are related to medical causes of regression. So if you treat those causes, sometimes the regression might help. Okay, just rather than thinking that it's autism, so we have to find, is there any cause for regression happening? So if all medical causes are fine, now you start basic intervention. So what is important when child is showing language regression? First thing important is improve the language stimulation, increase the language stimulation. That is what first we have to do. Increase more time, give more time, whatever we say. However, the in a lucid language, increase more time with the child. That's very important. So I tell just parents to 3 days you take him for walking, 3 days you take him for walking. What you do in walking, you'll just take him and keep telling him, I am seeing this, we are seeing this, whether child is responding, not responding, don't worry. Your job is to just bombard him with words. Stimulate, stimulate, stimulate. That's very important. So one is enrich. Whenever you are seeing some language regression or social regression, immediately increase the language stimulation. That allow him to join to the take him to the park. I always tell parents, the school is like a medicine. Sometimes playgroup schools are like a medicines. They work. Whenever they go to school, you see that children start speaking rather than your medicines, because there is a stimulation. They look at other children and they start imitating. So school, park, taking them to park is very, very so frequent. So they get a lot of language stimulation, and you talk to the child and play with them and imitate what they're saying. Even if they're not speaking anything, just you imitate. So this is a principle called, when child is not imitating, first you start imitating the child. Whatever sounds they are making, you imitate. Whatever action they are making, you imitate. So once after some time, child will start, there is somebody who is looking at him, who is imitating him. So he will slowly start imitating. So that's what we call concept called joining in. You join him in his own world. After a certain time, you start seeing, he will start him. Because to language, main important is imitation has to come. And especially in imitation, there is one motor imitation. You tap, they will tap. Vocal imitation, you say some word, they have to repeat. When vocal imitation comes, speech will definitely come. So we have to work on this imitation. So spend more time, work on the imitation skills, and reduce the screen. So whether it causes autism, it doesn't cause autism, whether it causes language delay, but we need to reduce. So let's leave on the research how is the impact of a screen on the autism, but at least be practical and reduce the screen time. So that is very important. I think these 3-4 strategies will definitely help, and they can start basic therapy. If at all nearby any speech therapist is there, at least they can start. They will guide them how to imitate, how to start these vocal imitation and all. And basic like even OT is important. See, there is also a lot of now concept about when to start speech, when to start OT, whether we have to start OT first, speech first, OT start. There is no such specific recommendation. You start as early as possible. So because that's the good in larger interest of the child, that is what very important. So I think these things, a lot of kids who have just mild regression, they do get better with these simple interventions in 2 or 3 months. So yeah.
Sir, the strategies are really very practical, and it will be very, very helpful to the parents watching there. Before we wrap up, sir, let's play a quick round of true or false.
Right.
So I will make a statement and you will have to tell me whether it is true or false, and you can briefly explain. So let's start. Regression in autism only happens once. If it happens again, it must be something else.
In most of the cases, it happens once, but sometimes it can be like more than once also. So we have encountered some cases, some parents have reported like he had a GI disturbance, he had a regression. After 1 year, another GI disturbance, another regression. So after 2 to 3 times regression has happened. But important thing is regression generally happens before 4 years. This multiple regression means they will not going to have regression throughout their, like even in the adolescence and all. So, but most of the parents report generally a single time phenomena with the onset around this age of 19 to 21 months, or around roughly 2 years. That's the phenomenon.
Okay. All children with autism experience regression at some point.
As I said, like only 30 to 40% of children experience regression. Not all children with experience regression, but the many children, we can say, like as I said, some research have said even up to 40 to 60% of children report regression, but not all children with autism report regression. No, that's not the thing.
Okay. Autism regression can be triggered by emotional stress or a change in routine.
Yes, as I said, like it's not like we can say these are causes for autism. They are the preceding events. So a lot of parents do report some precipitating events before the regression, like maybe, as I said, some psychosocial causes, like they have moved from one place, there was a very good attachment with the one particular caregiver that he moved, or there was psychosocial stress in the family. So because of that, the parents were preoccupied. So after that, they have noticed it may be just because a child who was already having some symptoms, mild delay in the speech, already there was some delay in the typical development, and this child needs an extra language stimulation, and that language stimulation, when there was some reduction because of any psychosocial cause, we might have seen that kind of regression.
Vaccines cause autism regression.
Yeah, so I think the decades of research has said that vaccines do not cause autism. Okay, because it's being clearly shown in the evidence, and multiple studies have shown that vaccines definitely do not cause autism. Yes.
If a child regresses, it means the therapy isn't working.
Not necessarily. As I said, in fact, we say that children who are not getting, say, I have seen, like as when you ask the first question, why children, whether children have more than one regression. So some of the parents have reported, my child was getting better, again he lost skill. He was again getting better, again he lost the skill. Then we inquired in such parents, what was why there is multiple thing, and we found that some parents were reporting he was getting better. We stopped the therapy for some period of time because of certain things. Then there was decline. Again, we started therapy, he was getting better. Again, there was some decline. So in fact, so that's why when we say therapy, there are three important things in that. One is it should be early. Okay. Second is it should be continuous therapy. Intermittent therapy is not going to help. And third is quality of therapy. So one is early, second is continuous, third is quality, and fourth is intensivity. When we say what is recommended is sometimes we say 25 to 40 hours. So although that's practically sometimes difficult, I say at least 25 hours at least for a period of 6 months. That includes parents' time, therapist time. Not necessarily, because therapy means only it has to be the therapist time. No, even it's a parent time, therapist time, 25 hours per week. That's a minimum, at least for a period of 6 months. In the early period, will improve children with autism, irrespective of the severity. So for at least 1 year, it's very important. So as I said, so parents have reported when there is a therapy is not continuous. When they are stopping therapy, we have noticed that sometimes parents report mild regression again, but they again pick up the skills. So it's not like a child is having regression. That doesn't mean therapy is not working. So no, that's not true.
Thank you, sir, for sharing your expertise and knowledge with so much clarity and empathy.
Thank you
so much.
very much. Thank you very much.
To the audience watching there, if you feel today's podcast, it has made you informed and you could resonate with this podcast, please do not forget to like this podcast, share this so that others stay informed, and also please do not forget to subscribe our video channel. Until such next video and conversation that is relevant that comes, please do watch the video that is popping up on your screen. Thank you so much.